She was instrumental in demonstrating the substance use disorder is a brain disorder. So I would welcome and start going to have everyone introduce themselves, and they will all talk about, let's talk about with what is substance use disorder.
Okay, good morning, everyone. I'm Carmela Pirich. I'm the executive director at the Addiction Center of Broome County. I've been there for 16 years, and I'm also an adjunct professor here at BU, and I've been a professor in social work for 14 years and also the HDEV program. So, in speaking about what is addiction, what is substance use disorder, uh, essentially this is a condition that's a brain disorder, and the drug essentially will override all basic needs. It will override the need for food, the need for water, the need to reproduce. So essentially the drug becomes the way that the person survives. And if we think about, like this is not like other diseases, it's a bit different than other kinds of chronic diseases like hypertension or diabetes, in that the drug becomes the mechanism of survival itself. So even something so powerful like motherhood, the maternal instinct, the drug will actually override a person's maternal instincts. And the way that that happens is through the disruption of dopamine, and also that it's not just impacting the frontal lobe or the part of the brain that affects reasoning and judgment. It's actually working in the midbrain as well, so that it's strengthening the memories and experiences of how dopamine is creating relief, and it's reinforcing that memory, so it basically overrides all of the person's other kinds of needs. So even if we think about, maybe a heartbreaking situation where maybe like a mom is trying to convince their child like not to use a substance because of how much mom loves them, like it's just not going to work. The drug has become survival. So I will also invite the panel to chime in, and maybe do you want anyone else to contribute to that definition, or?
Yes,
Okay.
I want everybody to introduce and also connect with the audience.
Okay.
Hi, my name is Olivia. I am a peer advocate with the Addiction Center of Broome County. I've been working there for 3 years now. To speak about substance use, I am a person in recovery, so I've been there, and I probably can't say it as well as Carmela just did, but it overrides every instinct that you have. It's the only thing that you focus on. And I mean, to bring it back to, just like addiction in general, like this can happen with anything necessary. Like it doesn't have to be just a substance. You can get addicted to anything. So.
That is very nice, Olivia. And I would have from our student perspective, Kayla would like to talk about your experience with the students and your peers.
Yeah, so hi, I'm Kayla Toffman. I'm a senior here at Binghamton University, and I'm a member, I'm actually the lead researcher of BSMART, which is the Binghamton Student Managed Adderall Research Team. And those were such great definitions of addiction to follow up on that. Just a broad definition, I guess I would define it as a feeling of physical and psychological need to engage in substance use that really impacts every aspect of a person's life. I think they really had great definitions, so I would go more based on theirs, but that's how I would define it.
Yeah.
Hi, my name is Lina Dikdash. I'm an associate professor in the health and wellness studies. I'm a nutritionist and also a biologist with a neuroscience background. I founded BSMART, and now we're going to hear about the BMIND. These are research teams led by undergraduate students. We do research on substance use and mental health and other what I call neurobehaviors, such as stress, mental distress, motivation, resilience, and so forth. And the B-Minds, which will be introduced by Oshima, is basically looking at the impact of diet on brain health and function. Because I have a background in neuroscience, and I feel like so far everything was said was awesome, I'd just like to maybe elaborate further on the connection between the midbrain, or basically what's called the reward system. The reward system is a system that would help with survival. So this is where we feel pleasure, but also we have feelings to act upon. So the drugs activate the reward system, and there's a change in dopamine, as it was just mentioned. This will hinder the connection with the prefrontal cortex, which is what I call the CEO of the brain. The CEO of the brain. If you want to have a successful a company, you have to have a successful CEO to run the company. So the CEO of the brain is hindered, the function is hindered, and the reward system is always asking for more substance to motivate it, whether, like Olivia mentioned, whether it is it's drugs, it could be gambling. This is what the B-Smart has looked at. It could be other activities as well. And I would like to pass it on to Oshima.
Hello everyone, my name is Ishima Chowdhury. I'm a senior here at Binghamton University, a biochemistry major, and I'm also the research lead of B-Minds. So the purpose of B-Minds is to investigate the link between diet and different neurobehaviors, and just in general how nutrition impacts brain function. So in our past studies, we've talked about the Western diet, the Mediterranean diet, and how that influences how consuming either diet would influence your perceived stress or your mental distress.
Thank you, Shima, and thank you all the panelists for introducing and bringing this topic. Okay, so B-Smart and B-Mind, they are the student organizations in Binghamton University, our campus. So the question is, how has B-Smart research addressed the gaps in the literature on substance use among college students? How are you bridging this knowledge with the B-Minds teamwork? I would start with Dr. Lena giving us more information on the research with the B-Minds and the B-Smarts.
Thank you. So just to give you some background information about how B-Smart started, I always talk about the use of Adderall illicitly in my classes and how this impacts the brain function. And after so many semesters of talking about how this impacts the young brain, because the young brain is still developing until the mid to late 20s, I had a student who actually expressed concern why this information is not shared by the university. I couldn't answer that question, but I said we can do something about it. So I came up with the idea, let's do some research, because that would give the student more validity when they're talking about the substance, the Adderall use, the illicit use on campus. And I actually had 6 or 7 students who were interested in doing the research. So we started by researching the interest, the perception of why students want to use that. And every semester or every year, we expanded on our knowledge by addressing new research questions. So Kayla is among the 6th generation of B-Smart. It was founded in 2018. So we wanted to address a gap in knowledge among college students, and Kayla will probably talk about more what they're doing as a research and outreach team. So this is how it started. We have learned a lot from our research. We have learned that students believe that taking Adderall is safe because it's a prescription drug. They believe that it helps with their GPA. We have actually looked at the long-term GPA of students who use Adderall illicitly, and we found there's no evidence that Adderall, illicit use of Adderall can raise the GPA of students. And that's because of so many factors. Adderall is a stimulant. It prevents a student from sleeping, and sleep is needed to help with retention of this information. So over the long run, students may not be getting the information, the background information they need in order to progress through their studies. We found that we also asked the students what could hinder your use or what would dissuade you from using Adderall. The only thing that we found was hearing real life experiences, and BSmart has been doing a great job having at our seminars individuals who have actually used Adderall, whether through a prescription, but that was not the right prescription, or illicitly, and we have actually those life experiences that through a survey we learned that students really felt the message or received the message that we wanted to convey. Now with the B-Minds, since it studies the effect of diet on brain function, we were trying to also bridge the gap where how poor nutrition can make you more stressed, and if you're more stressed, you're less likely to be engaging in academic studies or leading a healthy lifestyle on campus, which can also, in a sense, bridge the gap with substance use sometimes.
Thank you, Dr. Lena. So the question I would like to pass to Kayla. You are, as Dr. Lena mentioned, that you do seminars and promote mental health among the students and help them do maintain the balance with their academic, requirements. So what strategies do you promote in your seminars? And we would like to know more about this.
Yeah, so definitely time management is a big one that we like to promote. I think a lot of college students struggle with that, with the transition from high school to college. They gain a lot of independence, and so that's something that is really important, because without that we can't really implement any of the other things I'm about to talk about. And then I think also sleeping 7 to 8 hours a night, that's something that a lot of people overlook, but that's really important, as Dr. Lena Bigdash was talking about, for that consolidation of memory. And along with that, what you're eating, what you're putting in your body, eating energy-sustaining foods, and omega-3s. Dr. Lena Bigdash can talk about that more. And then I think exercising, releasing those endorphins, and using the resources that are available on campus, not just the academic resources like the University Tutoring Center, but also the mental health resources. And BSmart actually holds an event every semester called Matters of the Mind, where we gather a bunch of the resources on campus and off campus as well, to talk about what they have to offer to the students. And we have it in the West Gym, which is really convenient because a lot of students can stumble upon it when walking from class to class. And so just showing students that those resources are available and having those face-to-face interactions with people from those organizations is really important. And then we also have some fun activities along with that, where we have yoga or Pilates and also therapy dogs as well. So yeah.
Thank you, Kayla. And it's very nice to know that you have yoga and those kind of fun activities, because definitely that makes it very easy for students to come to and enjoy too at the same time. Okay, we also have B-Minds here. Oshima, so tell us something, if the students are falling behind, and then how do you basically guide them for self-care? And I would also like you to tell us something like some resources that are available on campus, which are beneficial for students. And I remember that you have cooking workshops. That's so exciting. So tell us something about that.
Of course. So BMind's current research project is on the link between diet quality, emotional intelligence, and mindfulness. So while we are still in the process of coding data, I actually have some personal experience of how I've been able to guide students in terms of navigating academic life and trying to balance out their stress by promoting self-care activities. Since I'm also a pre-health mentor, lots of students come up to me with concerns about how they feel that if they were to pursue self-care activities, that they'll be falling behind with their academics and that they will fail their exams. What I have told them that has worked for me is that it has to be shifting your mindset. If you believe that if you take care of yourself that you'll end up falling behind, that'll end up adding more stress. However, if you think that self-care is beneficial for your well-being and end up it'll actually end up helping you in the long run, then I feel that students end up having a different perspective, which ends up increasing their mental well-being. So I've suggested for students to actually go calendar these type of breaks, like 1 hour to do some self-care activities, have a nightly ritual, and have actually come up to me and said it has worked for them a lot and has decreased their stress levels. Within our last year of B Minds, we've actually investigated the link between diet quality and perceived stress, as well as sleep quality and health promoting behaviors. And what we have found is that a high quality diet, which is comprised mostly of fruits, dark leafy greens, whole wheat, white meats such as chicken, and a lot of omega-3s, which is found usually in fish, that they are more likely to be participating in health promoting behaviors such as exercise, self-care. They are less likely to be having sleep disruptions. They are more likely to not show signs of perceived stress or mental distress. And as for some resources on campus, we have something called the Binghamton Healthy Initiative, so one thing that it does is that during final season, there'll be lots of de-stress events for students to participate in. And these consist of yoga as well, therapy dogs, journaling, and just like board game nights. I also feel that something that might also be able to help students would be to have some sort of app which could help track their nutrients in terms of the dining hall, just because diet does play a very large role with your mental well-being. I feel that if students are able to track both their macronutrients and their micronutrients, they'll be able to help them know if they're following a well-balanced diet.
Thank you, Shima. I really appreciate it. We do have these educational programs that are helping students on campus. We have student organizations and research. Carmela, your publication in harm reduction was really nice. It made me think in many directions. Will you please give us some information how we can address this issue from your perspective?
Well, harm reduction was actually quite separate from addictions treatment. And I think with changes in commissioners and changes at a state level, we're actually now really, really being encouraged to integrate harm reduction into addictions treatment. I can proudly say that ACBC was a very early adopter of harm reduction. We kind of always have been. And in order to really help the team make that shift many years ago, we actually changed our mission statement and we changed our policies so that if people challenged us, we could actually say like, no, actually, this is truly policy and why we do things this way. Because substance use disorder is so stigmatized, a lot of the reason why people don't get help is because of how they're treated, how they're spoken to, and when people feel stigmatized and don't get help, like that's a reason people die. People die from treatable conditions. So harm reduction certainly is a very, very huge continuum where on one end of the spectrum, we may utilize motivational interviewing or work with someone. I mean, and even like we could think about this not only with SUD, but also with something like fitness and weight loss, where maybe, you know, a healthcare provider might say, well, like, you need to drop down to 2,000 calories or less a day. And the person might feel like there is no way I can do that. And that feels really bad and it makes me feel bad. Or maybe the practitioner could say like, how about you don't eat after 6 p.m.? You know, and the person might be like, I can actually do that. And that doesn't make me feel bad. So not everyone that comes to treatment is really ready to say, like, I'm so ready to not ever use another substance. But they might say, like, but I'm willing to work on reducing what I'm using, or maybe decreasing the number of days that I use the substance. So ACBC right now is the only licensed outpatient substance use disorder clinic where we also have a syringe exchange. It's always been like a very separate thing, you know, where clinics don't provide sterile syringes or harm reduction supplies. But we actually, I don't know why we decided to do this during a pandemic, but we're like, yeah, let's open a syringe exchange during a pandemic. So at first we were a second tier program, which means that we could order all of the supplies and not pay for the supplies. And we started as a delivery model where we would let the participants know what we had, what sort of supplies, let them know what kind of gauge needles we have, and they would tell us what they wanted and we would drop it off. So now a couple of years later, we're actually a fully funded program where we have 3 dedicated staff that work fully on arranging the orders, enrolling participants. And the reason that we became a funded syringe exchange program is because the state is like, why do you have almost 50% women in your program? Like, that's very weird. That's not normal across the state. Because mostly men. Women feel even more stigmatized and don't get help in the same numbers as men. So I think that's part of why they wanted to fund us, because they wanted to kind of understand why. And I think that it may have to do with having a program that's completely run by women. So we also have a treatment referral rate of 54%. So 54% of our participants that engage in the syringe exchange also accept referrals to treatment, which is also pretty amazing. And that's a larger number than Johns Hopkins. So I feel really so proud of our team as to how open and receptive they are to harm reduction practices, and really just letting our participants tell us, like, here's what I need to work on, here's what I'm willing to do, and really not ever turning someone away because of where they are in their readiness process. So harm reduction, you know, can include syringe services. It can include the utilization of naloxone, fentanyl testing strips, and other kinds of strategies. And maybe I'll let everyone else chime in.
We're going to ask more questions from you because we really want to know. So we are making good progress with harm reduction, but not everyone can easily accept all aspects of harm reduction. So substance use disorder is not a moral failing, but one of many complex physiological disorders that must be treated. So I'm going to pass on to Carmela, and I'm sorry, Carmela, we have to make you talking more. So my question is, we want to know more about the center, and my question is, if you get a call from a mother or, you know, and she comes up with, like, my child is not well and we need your help, we want to know more about the process. What is confidentiality? How the process works? How the treatment looks like? What are the first steps? And, you know, if you can educate on that aspect.
Sure. Actually, that happened Tuesday. A mom reached out to one of our employees over Facebook, which isn't like our maybe our normal space of getting referrals, but she knows an employee and was like, oh my gosh, there's something really bad happening with my 15-year-old. He's not allowed to go to school right now. So people can come into the clinic Monday through Friday from 9 to 11 to do an assessment. They can schedule an assessment, but sometimes people might be so scared or so nervous. So we actually do have many staff that conduct outreach. So in this case, the clinician actually just went to their house and met with mom and met with her son, and they completed the assessment, and he's actually like pretty excited about starting some treatment. So we don't want to make something that is scary and stressful more scary and stressful, so they can come to us. We can go to them. We can do a telepractice assessment. We can do a telephone assessment. So there's different ways that we can meet with people to kind of determine what are their needs, what level of care might be indicated for them, and then what do they think that they want to do? What will they agree to do? So within our clinic, we have a main location in Binghamton. We have an office in Endicott, an office in Norwich, and we actually also have a satellite location on the campus of the Children's Home. So within the clinic, we do assessments, we do outpatient care, intensive outpatient, which is programming that's 3 to 4 times a week, 3 hours per session. We have a very intensive day treatment program where clients that may have co-occurring mental health disorders and not much support, they can program with us for 4 hours a day, 5 days a week. And we have clients that do that for a few months, and we have clients that do that for a few years. Which, if you can imagine, in listening to our panelists talk about food, sometimes our clients have no food. It's not a matter of like what's healthy or what can I prepare or omega-3s, like it's literally like there's no food. So we do also have a food pantry, and that's more delivery based right now. So our clients may have many needs, and substance use might be just one of part of what they're dealing with. The treatment can also include medical services, so meeting with psychiatric providers or nurse practitioners to kind of get realigned with perhaps seeing a primary care provider or a dentist or other kinds of services that they might need for their health. We do also provide peer services and have a growing staff of around 20 peers right now, with a new peer starting on Monday. We've had peers since 2017, and this was really, really game changing for our clients, because many of them, like because of stigma, because of previous experiences, might be participating in their treatment, but also either being outspoken or maybe internally being like, but this person read this out of a book and they have no idea what I've gone through, what that experience feels like. But a peer is a person with lived experience and can kind of take some of that unease away by saying like, yes, I actually have been in your shoes before, and here are some things that have helped me that you may or may not think would be helpful for you, but our peers really walk alongside our clients to help them in so many different ways. And I think for me as their coworker, like it's a huge blessing, because I feel like I go to work with like lots of miracles, and like it's inspiring. It's so inspiring. So yeah, that's part of what our services look like. Just harm reduction like really reinforces the need to just be accepting and kind. That is what's going to help people grow and change and kind of reconnect.
That's correct. The stigma is a set of negative attitudes. It often turns out to be the lack of information, and the rationality prevents a person from coming forward for treatment. I will forward to Olivia. She's a peer advocate, and I guess Carmela said very clearly that they work as a team, and it is so essential. Someone who has walked the walk. Recovery takes time. It requires ongoing support and guidance. And I would just forward this to Olivia to complete the talk, how she inspired other individuals who are, walking this walk.
So I think I would start with, when I'm meeting somebody for the first time, one cool thing about being a peer is I have more freedom to talk about my personal journey. And so I, try not to give them too much, but enough to like connect with them and let them know like, hey, like I've had to go to DSS, I've had to get emergency housing, and this is what I did, and just reinforcing that trust also. you know, as a peer, I might be the only person that they trust in the beginning. And, you know, sometimes I'll get a referral and, you know, this person has engaged a little bit with the clinic and, you know, the clinician will reach out and, you know, can you try to, you know, help me get them more engaged. And, you know, there was an instance before where, you know, I kept going to somebody's house. You know, he wouldn't answer the door. You know what I mean? But I would continue to be like, hey, you know, I would text him and be like, hey, I stopped by. You know, I don't know if you were there, but you know, I came. And you know, he would continue to make appointments, but then would not answer the door. And eventually he answered the door. You know what I mean? Because I showed that persistence of like, I'm gonna be here for you. You know what I mean? And so then once, you know, he opened the door, it actually opened the door to more engagement. And, you know, with being a peer, and we have so many vehicles for our staff. And, you know, I think that's one unique thing about ACBC is like, you have an appointment, I'm gonna take you. You know, and for myself, you know, I was also a patient at ACBC. And so I have utilized these services before, and having that accountability of like, someone's going to come get me for my appointment. I started to actually make appointments. You know, and one of my things is I would make appointments, but I would never actually go to them. So having somebody physically come get me is what, you know, eventually, you know, I was making appointments on my own and I didn't need them anymore. You know, and it's just that added level of support. Because transportation also is a huge barrier for people. And, you know, Carmela had mentioned that, you know, on Tuesday, the clinician just went out to the person's house. And, you know, sometimes that's where treatment starts, is in your house. And, you know, like we encourage, you know, eventually try to come to the clinic, but that trust and that comfortability has to be there first, so.
Just another question for you. With your interaction, has anybody ever asked you how long will I be in treatment, and what answer you have come up with?
So I have been asked that, and I always just bring it back to like that's on you. You know, I can, you know, I've seen it in various forms. You know, somebody could have perfect attendance and, you know, it could take them maybe 3 months to get through treatment. And then so, you know, sometimes even after 3 months, they may have perfect attendance, but they don't feel like they're ready. So, you know, we're not gonna push you out the door. We're gonna let you like get more comfortable with your recovery before we, you know, finish treatment. And then also with peer services, it's like you don't have to be connected to the clinic to have a peer. So I mean, I've had people talk about how they're almost done with outpatient, and they're like, does that mean I lose you too? And I'm like, no, you know, like I will still be here. You know, you can keep me as long as you need me. So, yeah.
That's very kind and compassion, and that's what they need, right? So nice. Kayla, I want to ask you, like, when you talk about your Be Smart, students fall behind, that's correct. They struggle with their grades, they struggle with work, they struggle to find a balance. And definitely they don't want anybody to know if they have ever used. So how is your being experience with the students? I know you conduct seminars, so tell us something.
Yeah, so as you were saying about how they don't want anyone to know, all of our surveys are anonymous. And when we're talking to people, we don't necessarily, we make sure that it's in a comfortable environment for them. But we have many forms of education, and one of them is our seminar, where we really try to emphasize the effects of illicit Adderall use or unprescribed Adderall use. And we include as well real life stories at the end of our seminars where people can really give a personal experience, and I think that's really impactful for students because it's not just a number on a board or something that we're talking about, it's someone's real life experience, and I think that that's not something a lot of students get to see. Yeah, we also have, we go into classes and we present a shorter version of our seminar to make sure we're reaching the greater population. We have collaboration events with other organizations. We had one with the Pre-Med Association, and we also had one with a resident assistant where we just really advocate against illicit Adderall use and really make sure to show students the effects. I mean, one of the results that we find repeatedly is that illicit Adderall usage is associated with lower GPAs. So that's a common misconception that we like to address. And then along with that, just tabling on campus and getting one-on-one conversations with peers is really great because that's also how we find people become interested in B-Smart a lot of the times. But just really getting that personal conversation with people, I think, is really important.
That's really nice to know that you have one-to-one meetings and you've been talking to the peers. One more question I have. So how you adapt your strategies depending upon, from a culture-based or the diversity, bringing that kind of an inclusion, how you do that, how you make them, how you work around it.
Yeah, so as I was saying before, we really try and make sure we have an inclusive environment and a sense of anonymity. I think maybe I can let Dr. Vigdash talk about that a little bit.
So basically, we open our seminar to everyone. We go into all classes as, not all classes, but all the people who we have reached out to and they are accepted to have us in their classes, we go to them. So these classes obviously have all kind of students. So we're hoping that we are reaching every potential student who would be, who would find this useful. Another thing that I also wanted to add is we did find in our survey that minorities tend to be the ones who mostly affected, and we also have found that those who are from higher socioeconomical could also be more affected by Adderall use as well. So I hope I answered the question.
Yeah, of course. Okay, good. Yeah, we wanted to know your perspective. And how does the center works around how you bring the inclusion in your services?
So I think we look quarterly at like who is coming, what are their ages, what is their race, their ethnic backgrounds. We do have at different times the clients have had different kinds of groups. We've had Spanish-speaking groups at times. We've had, and that was pretty cool because we got to order a lot of different AA and NA books in Spanish. So it really depends on who's with us and what their needs are. We've had clients, Muslim clients who wanted certain trauma therapies like EMDR, and we were able to modify the protocols so that the clinician had more space between the client and the practitioner, and that they did their own tapping. So I think there's a lot of different adjustments that can be made that help people to be more comfortable, and even just working with children. Like we have some clients that are very little that come in for play therapy and understanding childhood as its own culture. So we try to do more with training, and I think it's like an area for constant growth and training and improvement.
Thank you so much. And I have so say somebody comes up with the center, like I had a stressful day. A person just may have a drink to relax at home, like after a stressful day. How you tilt between the balance between just like a moderate drinking or someone, having towards dependence? Will you please give us some more perspective on this?
Sure. So I think in those instances, if maybe the person is not sure if they're developing a substance use disorder, we would look at the DSM criteria. And in New York State during COVID, alcohol sales increased 253%. So we started to see kind of towards the end of the pandemic and even now, individuals that we wouldn't really normally see come to treatment. People that work at the Raymond Corporation or BAE, or people that work for the federal government. But you might imagine, like, some people working from home could have been, you know, they were drinking more. So, and we're seeing lots and lots of DWIs. So I think, you know, ultimately there's social drinking that's non-problematic, but when it starts to cause problems in that person's life, or even if they're just starting to think that, like, I don't know if I'm really okay with this, that this could be starting to cause some issues. So we would definitely want to encourage that person, like, let's talk about it. Let's conduct an assessment and see what comes up.
Thank you so much. So during COVID, we all started cooking at home, more at home. So, so Dr. Lena, will you tell us how nutrition can, during this process, in this process of recovery, how nutrition can play a role and help us? Tell us about the ingredients, what we can add to our diet.
So since you mentioned COVID, I'd like to actually talk about one of my study. We looked at the changes in food intake before COVID, during COVID, and after COVID, and we found that many food that would not typically cause stress, increase stress by taking them. For example, in women, and we found that women were more affected than men. For example, we found that eating carbohydrates for women increased their stress during COVID. Caffeine is known to be a stimulant. It does increase stress, but it was even a cup of coffee would have increased the stress of women during COVID. So the diet had an impact on the stress, but in general, it's not really known, or well known, I should say, that the diet has an impact on the brain function. If we think about the brain needs ingredients for support, for maintenance, and for repair. If you're missing out on certain major ingredients, obviously the function of the brain is impaired. And that's part of my research is, so independent of the B-SMART and the B-Minds, I study how the diet impact the brain function and how the diet affects mental health, stress levels, and resilience, motivation, and so forth. So I go back to the points of ingredients. So the Mediterranean diet, and this is actually something that the B-SMART has published on, and Oshima is the first author, but also with other of my own research, we found that the Mediterranean diet has been associated with mental well-being, with stress reduction, and with resilience, and that's because the Mediterranean diet provides with a spectrum of nutrients that the brain needs. So if you're providing all the ingredients that the brain would require to build itself, you're obviously more likely to be resilient to stress. It doesn't mean that you won't feel the stress. It means that even though you may feel stress, you're able to rebound if your brain is healthy. We found that the Western diet is associated with mental health issues, with higher stress levels, with lower resilience. Again, because the brain is not able to repair itself, it's not able to maintain itself. So the brain really needs certain ingredients, and one of the things that Kayla mentioned is omega-3 fats. The omega-3 fats are part of, specifically there's an omega-3 fat that's called DHA, and this is part of the myelin sheath. The myelin sheath is an insulator in the brain that helps with the communication between brain regions. So if you're providing the good insulator between the brain regions, the communication is effective. So if we try to communicate between two rooms and there are no lines of communication between an institution, there will be a chaos at one point. If we have good line of communication, the brain is working effectively. So we found that DHA is an important part of the diet to support mental health, resilience, and other brain function. Another thing that I found through my research is that protein specifically in young adults, that those young adults who were missing on eating meat, and I'm not a big meat eater myself, but I'm just sharing my own research, those who miss on eating meat were more likely to suffer from mental distress and high stress levels. I'm not the only one who actually has published on this. There's another big study that looked at young men, husbands of pregnant women. They also studied their diet, and they reported that those who were not eating animal food were more likely to have higher level of mental health. So why meat? And I'm not saying that you have to go on a high protein diet. Meat could be part of the Mediterranean diet, like eating fruits, vegetables, legumes, nuts, and some meat would be very helpful for the brain, because the brain would require protein, efficient amount of protein. Plant food does have a protein, but not all the essential amino acid that's needed for the brain function. Meat is the source of B12, which is only found in animal food, not in plant food. Zinc is also important for the brain. Zinc is found in plant food, but it's not well absorbed. So there are many ingredients that come from the animal food that the brain would need. Again, I'm not going with the Western diet. I'm not going with a high protein. I'm going with the Mediterranean diet. The Mediterranean diet does include some meat. So I wanted to share this with you because with all the hypes now coming with the vegans, and I'm not saying anything wrong with that, but there should be more planning, more careful planning with these kind of diets, because they could, those who follow these diets may actually be deficient. So they need to be working with professionals on meeting all the required nutrients. So I hope I answered your question.
Yes, of course. Just a follow-up question. So you're a professor, you're teaching, so students must be coming to you. So the students come for advice, like what should I eat, especially during the exam period?
So actually students learn this in my classes, and I'm always happy to hear that they have shared this information with their parents, with their grandmas, with their grandpas, with their own friends. Sometimes they come to me asking, like, my friend was challenging about this. She saw something online and she showed me that whatever you said in class is wrong. And I said, give me the reference. The reference was a blog, somebody who actually wrote something because they thought that this is how they understood nutrition. So in my classes, I empower the student with the science. If they know the science, they can answer any question. So they come up with mostly like, how can I respond to this student or to my friends? And I always give me the reference, and I give them a scientific reference to explain that.
That's so nice. Yeah, absolutely. Another follow-up question was if anybody goes to the grocery store, so do we look at the labels, or what you generally advise?
Yes, always read the ingredients, the labels. So something that is very commonly I shared with all my students is the high fructose corn syrup, which is now has changed to corn sugar or corn syrup, because consumers are learning how it's bad for your health. So you could see a label saying high fructose corn syrup free, or like fat free, but you find it in the ingredient. Same with the trans fat. Trans fat could be labeled as trans fat free, but if you read the ingredients, you can find something called partially hydrogenated fat, and that's because you can play with the servings, so the food company can play with the serving size, and up to a certain size, you can still say that it is free of this substance. So always try to educate yourself on the major concept in nutrition, because there's so much gimmick out there just to fool the consumers.
That was very informative, Dr. Lena. So Ushima, you are having Bee Minds and you've been a lead researcher. You had your first author publication, which is congratulations. That's great. So, so the question is, on campus, like, even I like pizza, I like burgers. But so what other options would you always advise in your Be Mind to students? And would you have any suggestions that we should, with the current options, food options, do we have currently on campus for the students? So what are your suggestions as well as how you advise students?
Of course. So currently on campus, there actually are a lot more healthy eating options people may realize. These usually aren't as heavily advertised. So I usually suggest for students is to add nutrients into what they already have. So for like the hot lunch or like the hot dinner servings, sometimes you might have chicken, proteins, but not have a lot of micronutrients. So I might suggest for students to maybe add like a little salad onto the side. That way they can have a more of a comprehensible diet. Or perhaps the meal has a lot of carbohydrates, but they aren't having the protein intake then. So maybe I might suggest for students to perhaps go to simple servings or go to a different section and had some sort of protein source. Another place on campus I do like to eat a lot in particular is probably garbanzo, because I feel this is the option on campus that has the most nutrients and vitamins, as it has a large variety of vegetables that you can add to your rice bowl. Another thing that Be Minds actually also offers is our cooking workshop. This is a semesterly event, and this is particularly useful for off-campus students who don't have a meal plan, so they can't access the dining hall food. The way that we run it is that we like to use completely whole ingredients. We make a recipe book that has all the ingredients that we use, as well as the servings, and it also tells students the macro and micronutrients, as well as the cost breakdown. That way students will understand how to meal prep and just be able to have a cost-efficient, good sense of nutrients for the whole entire week. I apologize, did I miss any of your questions?
No, you're doing great. And also there's a flyer on the table which talks about the Be Mind and Be Smart. There's seminar meetings, there's a survey, which is really nice if you want to participate and know more about it. It's quite informative. I've passed to the Carmela, and I want to know, in your center, when somebody comes in, is the nutrition a part of your like assessment or guidance? How does it work at the center?
Unfortunately, I think we need to hire all of you, or fortunately, because honestly, I don't really even know what is a macro and a micro. And it sounds so interesting. I want to come to the cooking class too. I don't think that we really have a lot of nutrition information. We have had some community partners. There was a program called Eat Smart New York that would come in and do some cooking and food preparation with our clients in the morning and then in the evenings. And the people really enjoyed that, and it did help them to learn, like, here are things that you can use with your benefit cards, and that you could go to the farmer's market. So I think depending on kind of maybe what sort of stress the clients are under, that can be things that they really benefit from and enjoy. But sometimes, like, we're literally like dealing with circumstances where like there's simply no food. And they're in a hotel room with a microwave, so we're thinking about like can openers and if there's adequate refrigeration to do food preparation. So like that definitely would be something that we would love to pass on or incorporate, and I'm sure people would love that.
Seems like we've got a new collaboration.
Okay.
Okay, Dr. Lena, so let's go forward with that collaboration. You are hired. So now you are hired as a nutrition counselor. How, with your research, I know one of your publications did mention about the sugar correlation with the dental anxiety. I would say now you are hired, so now how you will guide us in the recovery process? with your research.
Yeah, thank you. I actually just want to add one thing that the Bee Minds, they do, we actually have looked into food insecurity, and because of that, we've been partnering with some of the food pantries in the community. So I think we would be happy to collaborate as well. And I'm sure I'm happy to help. The Bee Minds will be also helpful in maybe educating. So yeah, I think we can do some work together.
That's why we're doing it, right? That's why we're here.
So so about the dental anxiety, I actually had a student who was interested in this topic, and I said, okay, let's do it. So we surveyed also people in the dental offices about their diet intake and their anxious feelings when they visit, or even before visiting the dentist. And we found that actually eating some sugary stuff would increase anxiety before going to the dentist. We also found, we actually found something very interesting about caffeine. So caffeine is a stimulant, but at the same time, if you drink moderately, like a cup or two a day, this actually was found based on our research that is helpful in reducing the anxiety, the dental anxiety. I'm not saying if you don't drink coffee to go and start drinking, but those who drink moderately, maybe the brain has learned how to manage anxiety better than those who drink a lot of caffeine, or those who do not drink at all. Because and the theory here is that caffeine is a stimulant, so it may have primed the brain to get used to some level of anxiety or stress. So when people went to the dental office, they didn't feel that anxious compared to those who don't drink at all or those who drink a lot. So yeah, I think that was very interesting to learn about.
Yeah, absolutely. Okay, so I just wanted to forward to Carmela and talking about, with all the nutrition guidance we have the treatment, we follow the harm reduction, what a progress we all have made, and your center is helping. But I'm sure there must be still so many challenges. And when we talk about the recovery, will you please talk about a little bit on your perspective?
Sure. So I guess challenges and kind of when people are hitting bumps in the road in recovery, certainly if there's a recurrence of use or recurrence of illness, we want to support the person and kind of assist them in like kind of going back and looking inward, you know, is anything that maybe there's something in my life that I need to make a change. So like a lifestyle change, is there maybe a relationship that's not supporting their growth, or maybe their work environment isn't necessarily going to help them in their recovery, or maybe there's thought patterns or cognitive changes that could be impeding their recovery process. We'd also want to do some careful reflection to see, you know, is there any co-occurring mental health needs that need to be addressed? You know, if they're struggling with untreated depression, or there's some underlying trauma that maybe they need to work on that's going to help them in their healing process. And I think also just right now a huge need with our clients is safe, affordable housing. That right now between 20 to 25% of our clients are unhoused. So it is not unusual to be in our waiting room and people are literally coming in with huge duffel bags and rolling suitcases, and just, I can't imagine like trying to go through the day like that. And then they come in and they'll put their stuff in the lobby for a little bit and maybe go outside and go to the bathroom, and like how freed they might feel just for a moment to like not be carrying everything that they have with them. So there could be lots of issues and needs that come up, and maybe some that can be worked through a bit with some internal reflection and the support of their clinical team and their peers. And then there's just many things in the environment that, like, you know, the entire community needs to kind of come up with some strategies to help people, because without having some kind of safe, stable place to live, you know, in some respects, it's like just throwing huge piles of money on the floor and setting it on fire because, people aren't in a position where they can really heal and be safe.
Thank you, Carmela. With so many stresses in the society and the families also going through so much of pressure, I'm sure the students are also under a lot of pressure from the academic and also personal struggles. So Ushima, how, as a peer, as a mentor, when you run these seminars, how do you help students cope up with so many stresses?
Yeah, of course. With our current tabling event, since our current research is about nutrition in relation to mindfulness and emotional intelligence, a lot of our tabling is based upon how students can promote more self-care activities. That way they'll have less stress. So one thing that we advise for students to do is that we advise them to kind of take a step back each day and to reflect about their day. We've done outreach events where we've given out these journals where they'd be able to write down their reflection each day, different gratitudes. And we've also, in general, we make ourselves out there. That way, if they do have any concerns, they could come to us and they could help them in terms of navigating the different diets on campuses. If they are having some sort of difficulties with knowing what kind of food to eat, then we are able to do that.
Thank you, Shima. I wanted to ask one more question to Carmela. And with all the stresses, and recovery is definitely full of challenges, and center must be coming across like overdose, and how you prevent, and what strategies at least you kind of offer, and how you manage, in your center if such cases do come.
So overdose prevention? Okay. Well, we try to screen everyone we can to sort of assess like what is their overdose risk potential. So pretty much every person that reports use of opioids, every person that reports any use of methamphetamine because of cross-contamination with fentanyl, but also we kind of need to start thinking about doing that screening with people that are using cocaine as well because of cross-contamination of fentanyl in cocaine, and that's like a growing area of unfortunately overdose deaths. So some of the questions in the screening, and we use a tool that's in the public domain called the ORAT, ORAT, Overdose Risk Assessment Tool. It's out of Canada, but it asks, so we'll ask the client questions like, do you use by yourself? Do you buy your drugs from the same person most of the time? Do you ever, use everything that you have kind of all at once? So asking questions to think about like creating a safety plan, that if they're going to use by themselves, do they have access to a phone number called Never Use Alone? There's a hotline like that people can use and call this number, and if they stop responding, then they're going to call paramedics for that person. There's an app called Brave that does something similar. There's an app called Canary that does something similar. And we want to make sure that our clients have naloxone. So making sure we give out kits, that people are trained to use them, that people around them are trained to use them, like their family members or their partners. So that's really important. They can test their drugs to know if there's fentanyl in them. So encouraging testing. No.
I would say, going back to, Carmela had talked about how there's a housing crisis in the area, and having their basic needs met, being housed, and, that alone can prevent an overdose. And she had mentioned also the Never Use Alone line. I've had clients use it. I give it out as much as possible. It's usually a question that I ask when I am giving somebody supplies, like syringe exchange. And we hand out Narcan like it's candy too. will put it in almost every single package that I hand out. I will, like, so say someone, says I don't need Narcan. I'm like, well, because they think, they're using methamphetamines that they don't need it. And I'm like, well, maybe it's not for you. Why you have it? And so that maybe they're like, oh, okay, I'll take it then. So yeah, we hand out Narcan like it's candy. And I also, one of the favorite things that I do is I do ride-alongs with specifically the Binghamton Police. We do it with every department in Broome County. But I do them with the Binghamton Police, and so we are provided with the list of overdoses in Broome County. And so I go out with the Binghamton Police and we go and check on them. And offer help. And then sometimes they're a little mad that the police are there. But 9 times out of 10, they are so happy that somebody is checking on them and making sure that they're okay. Because, I personally overdosed myself, and it's scary. It's not fun. And just the fact that somebody, is coming to check on them, it means something. And, if I provide my phone number, I've had people months later, they randomly find my number, and then that in that moment, they might want help. And, that's overdose prevention right there. Just having my number floating around in their house and they might come across it is, it's just planting that seed that, somebody's there to help. So yeah, we try to, make sure that they're using hotlines or using with other individuals, or, sometimes I also just text them and be like, hey, how's it going? And if I don't get a response, I will do a wellness check. So yeah, we're out there and on the front lines.
Awesome. That's so nice. Awesome. Yeah, so I would just say we can compare the substance abuse disorder to just any disease like diabetes. There is a genetic predisposition. We have to make healthy habits. If we make healthy habits, if a person is, suspected, or the doctor says no more sugar, or you have to look at take a healthy food and get counseling from Dr. Lena. So that's our all own decisions. At that point, we don't blame ourselves, right? We make those decisions. Similarly, substance abuse disorder, we have to treat and the disease, and there should not be any stigma, because that also involves just making healthy habits. So NIH HEAL initiative, which is helping to end addiction, it's a long-term initiative, and they're studying whether a vaccine can treat this disorder. So the future has a lot of hope. We just have to be full of compassion, kindness, and make them to come to the center for the treatment. We don't want them to go away, because there's so much of hope there. And with this, I open this for the questions from the audience.
I have one. What age group do you provide the most services? Thank you. What age group do you provide the most services to at ACPC?
Probably young to middle adults is like the largest number.
But I did do a quick report yesterday, and we have 25 clients that are 0 to age 11. And our total from 4 to 18 is about 75. So we have a number of teenage clients. We have little ones that come for play therapy. Our first play therapy patient was a little over a year ago. She was 6 years old, and she saw her mom's fatal overdose. So we are very happy to have littler children coming, because I think as young as possible to let people know it's okay to come for help. Everybody needs some help sometimes. So to try to take away the stigma associated with help seeking. So, but yeah, I would say right now our largest is young to middle-aged adults.
Thank you, Carmela.
Yes.
I had a question for Dr. Lena. So, obviously, especially with young people, it's very important to make sure they're being mindful of their nutrition and macros and nutrients and all of that. But how do you make sure that you draw the line between being mindful and it becoming an obsession or a disordered behavior in young people that could lead to worse mental health conditions?
I think being mindful and educated on nutrition should gear people away from being obsessed with food. One of the things that I used to do in my classes, and I stopped doing it because I realized that students were taking it the wrong way, is I would give them an assignment to track their diet, and student would take it as I'm tracking my calories. And I had to explain to them, no, tracking your diet means that you're meeting your macronutrients, which are carbohydrates, protein, and fat, and micro minerals, which are your vitamins and minerals. And I didn't realize until the student told me that, or the way she responded to this is that she's concerned about eating disorders. And I didn't realize why she was saying that until it hit me. It's like she took it as tracking calories. And I had to explain to them, no, it's like you need to know what you're deficient in. And actually I stopped doing this in my classes because I thought that was helpful to students. I realized maybe it's not. But I think having a good education on nutrition and understanding your macronutrients, your micronutrients, and how these actually help with your health will gear people away from eating disorders. And I think this is very important because unfortunately there's a lot online that most of, maybe all young adults are learning from TikTok, from social media, that are not the accurate information. Did I answer your question?
Yes. Yeah, thank you so much for sharing all the, it's so useful information. Like, these are all good to know, right? But so many people, as you know, have food insecurity. And so I look at it from that equity lens. It's like, I have that ability, you have that ability, and other people may have that ability to be able to say, like go into Wegmans or other places, right? And be able to pick out all of these components when some don't have that, right? So it's really looking at how can we, with this useful information, how can we support that conversation or implementation of different outreach and different programs? How can we use this, I guess, for the betterment, but also ensure that we have enough resources to be able to support your work or your findings? Because it's good to have this information, but it doesn't do somebody else any good that doesn't have the funding, right? To be able to buy salmon, to be able to go to Wegmans and get, I don't know, steak that's a ton of money, or chicken and I don't know, garbanzo beans. Oh, garbanzo beans are 67 cents, I think. You know what I'm saying?
Yes.
I think it's great, but I would encourage just like more collaboration, I guess more intentionality about how we're approaching when we're sharing too.
Yeah, that's a very good comment. And anyone wanna comment? Okay, yeah.
Yes, that is a really great concern. Last year, since Be Minds, our main focus event was on food security and its relation with these different neurobehaviors, a lot of our outreach projects were with food pantries in particular. So like so basically last year we collaborated with Ben Franklin Elementary School, and we're planning on collaborating with them again this year because they have a food pantry on site through something called the PAT Coalition. And so basically what I did was that I made like these particular recipes using the food pantry essentials that they have. So in that case, they'd be able to just pick up the ingredients right after the cooking workshop demonstration, and they won't actually have to pay for anything out of pocket. So whenever we do collaborations with the food pantries, we only use ingredients that are actually available in the food pantry. This semester, we're partnering with the Salvation Army Church, and so every week we come in and we see what fruits are available. And depending on those produced, we make new recipes too each week to distribute to all the people who are using it.
Have you worked with the Rural Health Network?
We got connections for you.
Yeah. So we're trying to do our part, and I'm happy that we were invited, and thank you so much for the invitation. So we can do more. From our part, we're doing the research. We're trying to connect with the community, but we're also limited. So this way, I feel if the community know more about our work, we can find more ways to help people out.
Yeah, this is one way.
Yeah.
Yeah, because there's other programs out in our community that are doing similar work. There's the food prescription that Rural Health Network is doing, and so that would be something that I'm sure they would be ecstatic to just collaborate with you.
And we would be happy to know more about them. We're trying to learn more about the community. So maybe Oshima can take your contacts and maybe communicate with you for further collaboration.
Don't be surprised. Our organization, Care Compass Network, we cover over 9 county regions.
Wow.
Wow, that's great.
So I also do want to mention that I have another Be Mind student here, Rania. So she could be also the liaison that we need.
Yes, I mean, New York State has the Care Compass Network just received a social care network for our 6 county regions. So one of the 4 health-related social care needs is nutrition. So that's definitely one of the identified needs of our New York State across the nation.
So,
Any more questions? Okay, we have one more question.
So I found it really wonderful with all the information around the nutrition and how it correlates to the stress levels and recovery and all of that. And one of my thoughts is, especially when we talk about food insecurity, is the families who are living in shelters, the families who are living in the hotels, or the families that are living out of their cars, don't have the access to stoves, to whatever. Excuse me. And what I'm really thinking about is the children. And so when you talk about whether it's the omega-3, the zinc, whatever, what's your thought on supplements, particularly for children?
So in nutrition schools, we learn that food should be the primary, but in that case, if it's not available to children, I would say that's going to be the second choice. So for the omega-3 in particular, since the supplements are not FDA regulated, this is the issue, and the omega-3 comes usually from big fish, and big fish tend to harbor more toxins in their fat, and omega-3 is a fat. My advice, not only for children, but for everyone who's going to take omega-3, is to make sure that the supplement has been tested by a third party. So some of these supplements would have a seal of quality that it shows that it has been tested for purity, for efficacy. So whatever is on the label is actually true, because if it's not FDA regulated, anyone can write anything on the supplement. So this is my advice, but if food is not available, that supplement should be provided to the children, yes.
Thank you so much, Dr. Lena, and for all the information. And I thank you, everyone. Thank you, all my panelists. I don't want this to end. I'm really enjoying every bit of it, but we are on schedule. We have to end at noon. So, but thank you so much. Thank you, panelists, everybody.